Hi my friends. So my name is Dr. Sayyeda Amna Mehmood. So today I try to select the topic of the endometrium and its different phases in the periods or the female cycle. This is first we know about the definition. The definition, what is the endometrium? The mucous membrane, the lining in the uterus that are thickened during the periods on the menstrual cycle in preparation for possible to implantation of an embryo or the fetus, or either it is shedding during the cycle or the periods. The normal endometrial changings is appear in the menstrual cycle, as you know. So what is the changing and what is the phases are we have to see. So the phases of endometrium are four: is menstruation, is a bleeding of the periods, follicular phase, ovulation, and the luteal phase. As we see this picture, so you see this is the graph to shows the first day of the cycle to 14 day and 21 to normally we have count the normal cycle at 28 days. So this is the body temperatures is also change in ovulation, as you remind in your gynae ops lectures, and there is some hormonal changings which is FSH, LH, estrogen and progesterone, and there is a cyclic changing related to the uterine body in the endometrium. So first we have to see the hormonal changing. The hormones is important is the progesterone and estrogen, which are taking the very strong effect in our cycle. So when the progesterone, as you see this line is the starting from the periods day 1 to 14 is very low, and the estrogen are going to be a high, and then in the mid of the cycle the estrogen is high level with the FSH, with the LH surge. So you see the LH is also low, and then it is equal to the estrogen level. So LH and estrogen are equal, and FSH and the progesterone in the mid cycle is down. Then FSH is going to be down to just is ovulate the egg, here the egg, and then the ovulation will be occur. This is the important only in FSH, the follicle stimulating hormone, which are released by our brain. So it is releasing here the egg, which is called as the ovum and or conferus ovulus for the follicle, and then releasing to form the either the corpus luteum, and corpus luteum releasing to the hormone of progesterone to maintain of the pregnancy, or it is either to shut down the endometrium to down all the hormones and shut down again to this cycle starting from here the first day to shut down the endometrium become to be a thin. So this is a menstruation period in between the 1 to 7 day, or some 2 is about the 3 days 4 days, whatever the female have the cycle of the variation. Then is a proliferative phase to produce the eggs. Here is a forming of the follicle, and here is development of the endometrium. The endometrium going the mid cycle is thick, and then it is also developing a thickness to launching of the embryo or either it is shut down. So this is very important to know. The hormonal changes I discuss as the estrogen and progesterone, and also the one hormone is testosterone is little bit in the female is high but not too much high. It is a male hormone. That's why sometimes the polycystic ovaries, and this is which hormones we have to test it to see that there is not the too much high for the male hormone to affect on the ovulation. So estrogen level raise during the mid follicular phase and then drop after the ovulation. Okay, the followed by the secondary raise of estrogen level during the mid luteal phase with the decrease end of the menstruation cycle. Now, the hormonal change in the cycles is as I always discuss. So, as previously discussed, so this is the progesterone level is also important. The progesterone levels are often low during the first stage, follicular stage. Okay, and ovulation, when the follicle will be formed, the egg or confidence is released from in the fallopian tube. So it is important to know whether the lady is going to be pregnant or is lady is going to be down. So progesterone levels are very important. If the cycle or have the progesterone is high, so it is going to be towards the side of the pregnancy. Now you see the endometrium related to the stage of the in ultrasound. So ultrasound, you have to see the thinning of the endometrium. Then on the follicular phase is a 3 line which is called as the Thippel line, and then the dominant follicle is little fluid are also come, which is also help in the ovulation, which is called as an ovulatory fluid, and then is a follicle will be coming here, and either the pregnancy embryo will be embedded or either it is will be shut down. So this picture is always remember, and this cycle is also remember about the follicular phase to form the egg and to release to form the corpus luteum. Luteal phase is also important. It start with the 15 to 28 days. If anyone has the prolonged cycle, the last 14 days are the luteal phase. Always remember, the luteal phase prepare the uterus for the pregnancy, thickening the uterine line, and disorder involving in the luteal phase can affect the pregnancy. So if there is any infertility, you have to check the is there is a 3 lines are formed or not formed in the late proliferative phase or the luteal phase. Then you have to see check if there is a thickness not thickened, so it means there is some disorder in the luteal phase. So what is the important is the hormonal change in the postmenopausal. The postmenopausal is mainly from the if there is a premenopausal effects is before 45, which is also related to the increase of the FSH hormones, or in between the 50 to premenopausal is called menopause is after the 50 or 55, and after 60 is a postmenopausal. Disorders of the hormone will be started, and we have to check this which is related of the estrogen levels, FSH levels, and the both reduce of the size of the ovaries in the ultrasound, and the lining is very thin. If there is line is like you see is not thin, is less than not 5 millimeter, you have to see these things to follow up. Either there is a no endometrial carcinoma, polyp, or anything will be developing in this endometrium problems. So you have to know the postmenopausal is also have the uterine subabnormalities. Thank you so much.